Skin Cancer 101, what you need to know. What is skin cancer? Skin cancer starts in the cells of the skin. Some other types of cancer start in other parts of the body and can spread to the skin, but these are not skin cancers. These are the three main types of skin cancers: basal and squamous cell skin cancers, basal cell carcinomas. Basal and squamous cell skin cancers are by far the most common cancers of the skin. Both are found mainly on parts of the body exposed to the sun, such as the head and neck. These cancers are strongly related to a person's sun exposure. Basal and squamous cell cancers are much less likely than melanomas to spread to other parts of the body and become life-threatening. Still, it's important to find and treat them early. If left alone, they can grow larger and invade nearby tissues and organs, causing scarring, deformity, or even loss of function in some parts of the body. Some of these cancers, especially squamous cell cancers, can spread if not treated, and in some cases they can even be fatal. Melanomas. These are cancers that develop from melanocytes, the cells that make the brown pigment that gives skin its color. Melanocytes can also form benign, non-cancerous growths called moles. Your doctor might call the mole a nevus. Melanomas can occur anywhere on the body, but are more likely to start in certain areas. The trunk, chest, and back is the most common place in men. In women, the legs are the most common site. The neck and face are other common places for melanoma to start. Melanomas are not as common as basal cell and squamous cell skin cancers, but they can be far more serious. Like basal cell and squamous cell cancers, melanoma is almost always curable in its early stages. But if left alone, melanoma is much more likely to spread to other parts of the body where it can be very hard to treat. Causes and risk factors. Skin cancer occurs when errors or mutations occur in the DNA of skin cells. The mutations cause the cells to grow out of control and form a mass of cancer cells. Much of the damage to DNA and skin cells results from the ultraviolet radiation found in sunlight and in the lights used in tanning beds. But sun exposure doesn't explain skin cancers that develop on the skin not ordinarily exposed to sunlight. This indicates that other factors may contribute to your risk of skin cancer, such as being exposed to toxic substances or having a condition that weakens your immune systems. Some risks are if you have fair skin, anyone, regardless of skin color, can get skin cancer. However, having less pigment in your skin provides less protection from damaging UV radiation. If you have blonde or red hair and light-colored eyes, and you freckle or sunburn easily, you're much more likely to develop skin cancer than as a person with darker skin. Having a history of sunburns. Having had one or more blistering sunburns as a child or teenager increases your risk of developing skin cancer as an adult. Sunburns in adulthood are also a risk factor. Excessive sun exposure. Anyone who spends considerable time in the sun may develop skin cancer, especially if the skin isn't protected by sunscreen or clothing. Tanning, including exposure to tanning lamps and beds, also puts you at risk. A tan is your skin's injury response to excessive UV radiation. Sunny or high altitude climates. People who live in sunny, warm climates are exposed to more sunlight than are people who live in colder climates. Living at higher elevations where the sunlight is strongest also exposes you to more radiation. Moles. People who have many moles or abnormal moles called dysplastic nevi are at increased risk of skin cancer. These abnormal moles, which look irregular and are generally larger than normal moles, are more likely than others to become cancerous. If you have a history of abnormal moles, watch them regularly for changes. Precancerous skin lesions. Having skin lesions, known as actinic keratosis, can increase your risk of developing skin cancer. These precancerous skin growths typically appear as rough, scaly patches that range in color from brown to dark pink. They're most common on the face, head, and hands of fair-skinned people whose skin has been sun damaged. A family history of skin cancer. If one of your parents or siblings had skin cancer, you may have an increased risk of the disease. A personal history of skin cancer. If you developed skin cancer once, you're at risk for developing it again. Having a weakened immune system. People with weakened immune systems have a greater risk of developing skin cancer. This includes people living with HIV or AIDS and those taking immunosuppressant drugs after an organ transplant. Exposure to radiation. People who have received radiation treatment for skin conditions such as eczema and acne may have an increased risk of skin cancer, particularly basal cell carcinoma. Exposure to certain substances. Exposure to certain substances such as arsenic may also increase your risk of skin cancer. Signs and symptoms. A change in your skin is the most common sign of skin cancer. This could be a new growth, a sore that doesn't heal, or a change in a mole. Not all skin cancers look the same. Basal cell carcinoma usually occurs in sun-exposed areas of your body such as your neck or face. It may appear as a pearly or waxy bump or a flat flesh-colored or brown scar-like lesion. Squamous cell carcinoma. Most often, squamous cell carcinoma occurs on sun-exposed areas of your body such as your face, ears, and hands. People with darker skin are more likely to develop squamous cell carcinomas on areas that are often not exposed to the sun. May appear as a firm red nodule or a flat lesion with a scaly crusted surface. A simple way to remember the signs of melanoma is to remember the ABCDEs. A stands for asymmetrical. Does the molar spot have an irregular shape with two parts that look very different? B stands for border. Is the border irregular or jagged? C is for color. Is the color uneven? D is for diameter. Is the molar spot larger than the size of a pea? E is for evolving. Has the molar spot changed during the past few weeks or months? Talk to your doctor if you notice changes in your skin such as a new growth, a sore that doesn't heal, a change in an old growth, or any of the ABCDEs of melanoma. The most common places to get skin cancer are on your face, scalp, neck, hands, chest and back, and legs. You must also be careful of the unexpected places to get skin cancer, such as behind the ears, between the buttocks, the mucous membranes, between your toes, and the palms of hands, soles of feet, and your nail beds. There are plenty of ways to stay safe in the sun, some including seeking midday shelter, covering up as much of your skin as possible. Don't underestimate a cloudy day. 80% of the sun's UV rays can make it through the clouds. Find shade, especially at the beach, pool, or if you have a job outdoors, since people are in these places for extended periods of time. Wear sunscreen with broad spectrum protection for both UVA and UV with at least 15 SPF. Read cosmetic labels. Some cosmetics contain chemicals which may increase your skin's susceptibility to sunburn. Take time to read the labels on your makeup. The same rule applies to many prescription medications. Check with your pharmacist to see if you need to take any special precautions. Always wear sunglasses with at least 99 to 100% UV protection. And check the UV index. Not sure how to plan for your outdoor activities today? Look up the UV index for your local area. The UV index, developed by the National Weather Service and the Environmental Protection Agency, is based on a scale of 1 to plus 11. The higher the number, the higher the amount of UV radiation reaching that part of the earth. So have fun and be safe. And finally, some skin cancer statistics. Skin cancer is the most common of all cancers. About 3.5 million cases of basal and squamous cell skin cancers are diagnosed in this country each year. Melanoma, a more dangerous type of skin cancer, will account for more than 73,000 cases of skin cancer in 2015. Each year, there are more new cases of skin cancer than the combined incidence of cancers of the breast, prostate, lung, and colon. After the past 3 decades, more people have had skin cancer than all other cancers combined. 1 person dies of melanoma every hour. Melanoma is the most common form of cancer for young adults 25 to 29 years old, and the second most common form of cancer for young people 15 to 29 years old. On average, a person's risk for melanoma doubles if he or she has had more than 5 sunburns. Regularly daily use of an SPF 15 or higher sunscreen reduces the risk of developing squamous cell carcinoma by about 40% and the risk of developing melanoma by 50%. More people develop skin cancer because of tanning than those that develop lung cancer because of smoking. Up until age 49, significantly more women develop melanoma than men. 1 in 206 women versus 1 in 297 men. From age 50 on, significantly more men develop melanoma than women. Overall, 1 in 33 men and 1 in 52 women will develop melanoma in their lifetimes. An estimated 6,750 men and 3,380 women in the U.S. will die from melanoma in 2016.